In modern medicine, the term surgery is an operation performed to put an end to a disease or a pain by reforming body organs. Today, we are going to talk about the top 10 most difficult and dangerous surgeries. Number 10. Septal myotomy. This surgical operation is performed to decrease the congealing of the heart muscles, which is a symptom of patients diagnosed with superior stages of a multifaceted sort of heart disease called hypertrophic cardiomyopathy. This is a difficult operation as it needs the patient to be put on cardiopulmonary bypass, so that the surgeon can perform on a motionless heart. Indeed, this surgery can take from 3 to 6 hours, and the recovery period needs an accommodation in the intensive care unit. Number 9. Bariatric surgeries. Surgeons employ particular instruments as internal organs are usually hard to divide. Patients also suffer an increased risk for difficulties with anesthesia, as it is often complicated to put in the tube inside their airways. Breathing must be strongly checked before, throughout and after the surgery, as patients are more expected to be exposed to an advanced risk of increasing of pneumonia. Number 8. Thoracic aortic dissection repair. Aortic dissection is a tear in the deepest layer of the heart that can cause many hazardous complications such as heart failure. Urgent treatment is needed, and this often leads to the surgeon eliminating the area of broken down aorta and reconstructing the blood vessel with an artificial fix. Number 7. Bladder cystectomy. This operation is performed to eliminate a part of, or the whole urinary bladder, with patients identified with bladder cancer. The main risks for this operation includes the inflammation of the covering coating the abdomen. There is a danger for urine leakage from the bladder opening location. Number 6. Spinal osteomyelitis surgery. There are many of treatments that patients can experience prior having this surgery to correct this spinal infection. Illnesses of the spine are very destructive, and any surgical operations performed on this region lead to risks of full or partial paralysis. Number 5. Craniectomy. A craniectomy is a very dangerous operation done in the brain. This operation needs the portion of skull eliminated to reach the brain, and it is not replaced when the surgery is done, leaving the patients with the danger of brain damage. Other risks include loss in the vision, mobility and memory. Number 4. Separation of conjoined twins. It almost certainly represents the most varied set of specialties needed to do a flourishing operation. Brain surgery is typically done by a neurosurgeon, and that of the hand is done by ortho or plastics surgeons. An adjoined twin separation will in all probability needs every specialties of surgery in the same room. Number 3. Coronary revascularization. It is known as coronary artery bypass grafting. The operation redirects the blood around one or more blocked coronary arteries to develop blood flow to the heart. Patients whose ventricular utility is deteriorating too rapidly are not recommended to have this operation as the dangers are too elevated. Number 2. Surgical ventricular restoration. This surgery is done to cure congestive heart failure due to a heart attack by getting it to its regular size and shape. It is very risky as the patient is placed on the heart-lung machine. Number 1. Esophagectomy. This is a key surgery that is very risky due to the rebuilding of the region between the stomach and the vigorous piece of the esophagus. Risks are available as seepage of the fluid from the stomach or esophagus when the new bond is made. That brings us to the end of today's video. Thanks for watching. Don't forget to like and subscribe to this channel. See you again next time. Bye bye.